Helicobacter pylori, commonly known as H. pylori, is a microscopic bacterium that has a significant impact on the gastrointestinal system. This bacterium is notorious for its role in causing chronic gastritis, peptic ulcers, and even increasing the risk of stomach cancer. In this comprehensive video, we will delve into the intricate details of H. pylori infection, including its symptoms, diagnostic tests, medical treatments, and home remedies. How is H. pylori contracted? H. pylori infection is primarily contracted through person-to-person transmission, typically in childhood. This transmission occurs via oral-oral or fecal-oral routes, often within families or communities with poor sanitation practices. Contaminated food, water, or utensils can also serve as vehicles for the bacteria. It's essential to note that not everyone who carries H. pylori will develop symptoms or health issues, as the outcome depends on various factors, including the strain of the bacterium and an individual's immune response. Tendency to cause cancer. One of the most alarming aspects of H. pylori infection is its association with an increased risk of stomach cancer, particularly if left untreated for an extended period. The bacterium can trigger chronic inflammation in the stomach lining, which, over time, may lead to the development of stomach ulcers and, in some cases, malignant changes in the gastric cells. It's important to understand that while H. pylori infection is a risk factor for stomach cancer, not everyone with the infection will develop cancer. Timely diagnosis, appropriate treatment, and lifestyle modifications can significantly reduce this risk. Symptoms: dyspepsia. Most individuals with H. pylori experience chronic indigestion, characterized by discomfort and bloating. Burning sensation, a burning or gnawing pain in the abdomen, particularly when the stomach is empty or at night. Nausea and vomiting, frequent episodes of nausea, and in severe cases, vomiting. Loss of appetite, a reduced desire to eat due to discomfort. Unintended weight loss. Weight loss may occur as a result of reduced food intake. Bleeding. H. pylori infection can lead to gastritis or peptic ulcers, causing bleeding in the stomach lining. Diagnostic tests. Breath test measures the presence of H. pylori in the breath. Stool antigen test detects H. pylori antigens in stool samples. Blood test checks for antibodies against H. pylori. Endoscopy involves a scope examination to visualize the stomach lining and obtain tissue samples for biopsy. Medical treatment. Antibiotics, a combination of antibiotics like clarithromycin, amoxicillin, or metronidazole, often prescribed for a specific duration. Proton pump inhibitors, PPIs reduce stomach acid production and aid in healing ulcers. Bismuth subsalicylate, used in conjunction with antibiotics, it helps eradicate H. pylori and relieve symptoms. Home remedies and herbal options. Probiotics. Incorporating probiotic-rich foods like yogurt can promote a balanced gut microbiome and support digestion. Manuka honey, known for its antibacterial properties, Manuka honey may help inhibit H. pylori growth. Consume a teaspoon daily. Licorice root tea may soothe stomach irritation. Green tea contains compounds that could inhibit H. pylori. Drinking green tea regularly may offer benefits. Garlic's antimicrobial properties may help combat H. pylori. Consume fresh garlic or garlic supplements. Mastic gum, this resin from the mastic tree has shown promise in reducing H. pylori levels. Take as a supplement. Cranberry juice, some studies suggest cranberry juice may help prevent H. pylori from attaching to the stomach lining. While these home remedies may provide relief, they are not a substitute for medical treatment. Consult a healthcare professional for a comprehensive assessment and treatment plan tailored to your specific condition. H. pylori infection is treatable, and early intervention can prevent complications and promote overall digestive health.